Good afternoon and welcome to today's session titled Tools to Help Care for Older Adults in Disasters, which is being co-presented by the offices of the Assistant Secretary for Preparedness and Response and the National Centre for Disaster Medicine and Public Health. Representing the National Centre for Disaster Medicine and Public Health will be Ms. Kandra Strauss-Riggs. Hello. And from ASPR, Dr. Cheryl Levine. A recorded version of this webinar will be available within 7 days. At this stage, I would like to turn this over to Mrs. Kandra Strauss-Riggs to proceed.
All right. Good afternoon, everyone. I hope you can hear us well. We have a lot of people joining the webinar. That's fantastic. I already see some former students of mine and colleagues in the field, so that's great. We are really excited to be co-presenting the National Center, Disaster Medicine and Public Health, and ASPR. It's a great collaboration that we have here. This is just my standard disclaimer that I'm speaking for myself. So I'm the Education Director at the National Center for Disaster Medicine and Public Health. It is my honor and privilege to serve in that role, and we are an unusual place. We were founded in 2008 under a HSPD 21, as it's known in shorthand, as an academic center of excellence. And we really bridge medicine and public health. We bridge federal and civilian, and military and civilian, and public and private. So we're really at the nexus of all of these players in the disaster space. We're housed at the Uniformed Services University, which is in Bethesda. So we have the privilege and opportunity to teach courses there and engage with student groups who are passionate about disaster health issues. And really, the National Center mission is framed around overall readiness, because of course, as those of you in the field know, preparedness and readiness are synonymous with each other. So it's really around keeping the nation prepared. And we do our work through education and training, research and scholarship, and collaboration and leadership. This means a lot of different things. We're busy all the time. Every day is different, and we develop educational products, which is what I'll be focusing on today. We also conduct reviews of the education that's out there. We make recommendations to the field, and we conduct research on educational activities and disaster health activities, such as hospital preparedness. We're involved with the Stop the Bleed campaign. We're leaders on that front. If you've heard about teaching the public to use tourniquets. But we also try to assess educational activities that are happening. And there's a lot of education and training in this space, and so part of why we were created was to put some quality measures against that and start looking at it. So, like I said, we bridge a lot of spaces. Our little image is a little small there, but we work closely with 5 departments. HHS, like we are today, with our partners at the Assistant Secretary for Preparedness and Response. Other offices of HHS as well. Department of Homeland Security, Department of Transportation, VA, and DOD. So we are lucky to work with all of these different agencies. Recently, we've had all kinds of collaborations happening, so I just wanted to show a few of those to you all. We work on lots of projects and are always interested in hearing from partners and looking to work with other folks. So just reach out directly if you have ideas. So, sorry that's small, but Cheryl will go into much more detail on this, but truly the context around caring for older adults in disasters remains problematic. We know that older adults are impacted at greater numbers than younger folks, and that really the impacts on them are severe. In 27, and just as recently as 2017 in Hurricane Irma, we saw 14 residents die in a Florida nursing home. I'm sure most of you are familiar with that case. That was due to heat-related issues when there was no air conditioning for the residents. And then that did spark the Emergency Environmental Control for Nursing Homes rules in Florida. Yet later in the year with Hurricane Harvey, we saw this terrible image that you all, I'm sure, are familiar with in Dickinson, Texas, where an assisted living facility had elders sheltering in place in waist-high floodwater. So we really continue to see these egregious cases and these very challenging situations with elders and disasters. So we look at this problem, look at this issue, worked with our colleagues at the VA and decided that really there wasn't much out there at the time when we developed this training a couple of years ago for the topic of caring for older adults in disasters. So we really came together and looked at the two vectors and where they overlapped and created this curriculum called Caring for Older Adults in Disasters. It is available on our website. I put the web link up, and it is, for those who might not be able to see it, www.usuhs.edu/NCDMPH. If you go in there under education, you can find the older adult curriculum. It is also available on the Public Health Foundation's Train Learning Network with the ID 1059666. And we were very privileged to work with over 20 subject matter experts who brought expertise, everything from elder care expertise to mental health and disaster expertise, access and functional needs expertise. We really worked with folks throughout the country who had devoted study and research to these issues to develop a competency-based, older adult-focused curriculum for health professionals. So our target audience, as with many of our materials here at the center, our curriculum is intended for adult learners who come from a wide range of health professions backgrounds. We always say it's sort of anyone who might end up playing a role in a disaster, particularly a health role of some sort. So the other reality is that, as many of you know, in 2016, the Centers for Medicare and Medicaid Services passed their emergency preparedness rule with a little time to implement it, which added 17 additional facility types and really covered the domains of risk assessment and planning, policy and procedure, communication plans, training and testing. So some of these facilities are long-term care facilities, nursing home facilities that particularly serve the older adult population. So certainly the target audience for this curriculum has expanded in the last several years as the rule has been implemented. I want to say a little bit about core competencies because it underpins all of our work at the National Center, all the curricula that we design. Published in 2012, but in a couple of years leading up to 2012, there was an effort to really develop these core competencies for disaster medicine and public health to address the education and training needs and really look at what are the basics that the community, the field, needs to know. And so experts convened and worked long and hard and got a lot of input from the community being the disaster health field, and published the core competencies. Simultaneously, ASPPH and CDC have public health preparedness competencies as well. So the idea, my pyramid is awfully small, but you know, we know that disaster health is an interdisciplinary, interprofessional field. So there are all kinds of amazing experts and specialists involved in the work, and each of them have their own competency sets. That's what this pyramid represents. All the higher on the pyramid competencies are for specialty groups, for particular professions, and those are great in the disaster space. Those are great. The core competencies, though, are meant to cover it all in the yellow section there and really be the foundation for what comes next in a specialty. So, okay, but back to the older adult curriculum. So using the core competencies, we developed a structure of 7 modules with 24 lessons. So these are the modules. They're available, you can do them individually on the website or all of it. They're available as PDFs at this point. And really, we attempted to cover the water, so to speak, of all the issues that face older adults in disasters. Obviously, there are a lot. So the lessons within this try to cover many concerns that we know are present when we're dealing with older adults in a disaster setting. I encourage you to go in and take a look at these modules and really go in deep. There's a lot of resources in there too, a lot of peer review papers and other tools and resources available to you. Each part has learning objectives, gives an estimated time, an outline, activities, readings, resources, evaluation strategies, and some capstone. The final lesson's a capstone activity. So, oh good, I had a more specific link on my final slide here, I thought so. So NCDMPH/older-adult-curriculum will get you straight to it. All right. Just a final note that we were privileged to be invited by the American Red Cross and the American Academy of Nursing to collaborate on a white paper that will be coming out in September. So I'm just going to mention a little bit about this. Unfortunately, it's not out yet for me to point you to, but I think that everyone on the webinar will be very interested in this. It's really around evidence-informed expert recommendations for caring for older adults. And it was a policy roundtable that was convened with multiple experts from different organizations, led by the Red Cross Scientific Advisory Council and Disaster Health Subcouncil, and then the American Academy of Nursing Committee on Aging. And so there's recommendations in each of these categories, and you can see it. So it's 9 recommendations on older adults and caregivers, and 3 recommendations on community-based programs and agencies. We will certainly be publicizing this when it comes out in September, and you will be able to take a look at these recommendations and see how they measure up with the work that you're doing. So I am very pleased to be here and happy to engage any questions after Cheryl speaks. And of course, you can always reach us through all the various social media platforms. We're always very happy to engage with all of you. Okay, and thank you very much to Alice McDonald and Norma Quintanilla, who are running the show behind the scenes here. All right, and we will getting it ready for Dr. Levine. Okay. Okay, Dr. Levine will take it away and talk to us about what ASPR is doing in this space.
Hi, Kandra. Thank you so much. This is Cheryl. So in celebration of Older Americans Month, it's a great honor and privilege to join with you today for this webinar. Thank you to Kandra and to the National Center for Disaster Medicine and Public Health for the opportunity to collaborate with you on those other products, as well as to share with you a new product. So today I'm going to talk to you a little bit about a new product, the Capacity-Building Toolkit for including the Aging and Disability Networks and Emergency Planning. And I'm Cheryl A. I am the Senior Advisor for At-Risk Individuals in the Office of the Assistant Secretary for Preparedness and Response, or ASPR, within the U.S. Department of Health and Human Services. Okay, so I'm driving. Let's see how this goes. There we go. Okay. So for those of you not familiar with ASPR, our mission is to save lives and protect Americans from 21st century health security threats. We work to strengthen our nation's public health and medical infrastructure and to improve capabilities necessary to quickly mobilize a coordinated national response to disasters and emergencies that are vital to our national security. And ASPR leads the nation's medical and public health preparedness for, response to, and recovery from disasters and public health emergencies. And to do that, we have a lot of partners. We collaborate with hospitals, healthcare coalitions, biotech firms, community members, state, local, tribal, and territorial governments, and other partners across the country to improve readiness and response capabilities. And then just a little bit about our legal authorities. So ASPR was established in 2006. This was in the wake of Hurricane Katrina to prepare for and respond to adverse health effects in the event of a public health emergency or disaster. And so the Public Health Service Act forms the foundation of our legal authority. And this legislation established ASPR and gives us the authority to coordinate with the public health and medical response and to work towards addressing the access and functional needs of at-risk individuals. So why do we use this term, access and functional needs? In the past, we've used other terminology, including special needs, vulnerable populations, hard to reach populations, at-risk individuals. But to be consistent with our partners at the Department of Homeland Security and FEMA and others, we now use the term access and functional needs. And this is the language and the approach that's used in this capacity building toolkit. And so what are access and functional needs? So access and functional needs refers to people who require assistance due to any condition, which could be either temporary or permanent, that limits their ability to take action in the event of an emergency. Access-based needs refers to ensuring that resources are accessible to all individuals. And this can include social services, accommodations, information, transportation, medications to maintain health, and so on. And function-based needs are restrictions or limitations an individual may have that require assistance before, during, or after a public health emergency or disaster. And also these access and functional needs can overlap. Okay, so with that, this is sort of to introduce you to a new resource, the Capacity Building Toolkit. It was developed by my program at ASPR with guidance from our colleagues at the HHS Administration on Community Living. And it was built through a cooperative agreement with the National Association of County and City Health Officials and the Association for State and Territorial Health Officials. So this resource is called the Capacity Building Toolkit for including aging and disability networks in emergency planning. So if you're not familiar with these aging and disability networks, I want to make sure I call them out. So the Aging and Disability Networks are ACL grantees. They're community-based organizations that provide essential support services to older adults and people with disabilities every day. We've come to recognize that their knowledge, experience, and expertise is critical to disaster and public health emergency planning. These community-based organizations can play a vital role as subject matter experts to ensure that consumers have access to community services, support, and disaster assistance. They can assist with identifying access and functional needs and provide outreach to older adults, people with disabilities, as well as their caregivers and family members. In various emergencies, these community-based organizations have undertaken activities, all kinds of activities, including conducting wellness checks, identifying gaps and addressing barriers to programs and services, providing situational awareness to emergency responders, providing case management, referral, and legal expertise, as well as addressing the needs for temporary housing and transportation services, and working to facilitate access to assistance for disaster victims. It's important to keep in mind that disruptions to services due to an emergency creates a risk that older adults and people with disabilities may not continue to receive services, which can have life-threatening consequences. So ultimately, the purpose of this capacity building toolkit is kind of one big overarching requirement and also meets three goals. So the big overarching requirement is to ensure equal access to our nation's emergency preparedness, response, and recovery resources. And to do that, we have three main goals. First is to provide information and resources for ACL grantees, the Aging and Disability Network, to become more engaged in emergency planning. ACL provides grant funding to community-based organizations for programs that support older adults and people with disabilities so they can remain in their homes and communities. So we want to make sure that we support these community-based organizations in undertaking their own organizational readiness planning. And second, we want to advance whole community planning. We provide tools and information to community-based organizations in order to support their consumers with developing their own personal preparedness plans. And third, we want to guide community-based organizations in identifying and working directly with partners, including emergency managers and public health officials in their local communities. Okay, so now I'll take a deeper dive into the three main goals of the Capacity Building Toolkit. So the first goal is emergency planning for community-based organizations. The Capacity Building Toolkit provides guidance for helping community-based organizations undertake their own organizational emergency planning. Activities such as identifying hazards, conducting risk assessments, and creating emergency operational plans are covered in detail, but described in a clear and simple way for non-emergency manager audience. Other topics that we cover include participating in training and exercises, engaging in consumer advocacy, and ensuring that older adults and people with disabilities are included in the emergency planning process. So the second goal is advancing whole community planning and supporting consumer preparedness. The Capacity Building Toolkit accomplishes this by providing information and resources for community-based organizations to use in supporting their clients and consumers with personal preparedness planning. This includes activities such as assessing emergency plans and support needed in the event of an emergency. And we provide information on helping consumers to understand the emergency services that are likely to be provided in the event of an emergency. Additionally, we provide information on supporting consumers with preparing their own emergency kits or go kits, understanding safety checks, and helping to navigate disaster assistance if a person does become a victim of a disaster or emergency. So the third goal is helping to develop partnerships, and specifically helping the ACL grantees, the Aging and Disability Network, to develop partnerships with emergency managers and public health officials. Here, the Capacity Building Toolkit provides guidance on activities such as sharing situational awareness and serving as subject matter experts on addressing access and functional needs. We also wanted to increase the awareness among the emergency managers and public health officials that aging and disability networks are available to consult on topics such as sheltering, evacuation, accessible transportation, and access to services and support. An important part of the Capacity Building Toolkit is highlighting these community-based organizations as emergency planning partners. They have data, information, and trusted relationships with consumers and caregivers, which are an important feature in emergency planning. The Capacity Building Toolkit describes the process of emergency planning and highlights best practices, tools, recommended resources, such as using national level data. So one of the data sources we recommended for emergency planning is the HHS Empower program. This program uses monthly claims data from Medicare to identify and provide maps of individuals who live independently in the community and rely on electricity-dependent medical equipment and healthcare services. Other recommendations include national data such as the Census and American Community Survey to help provide and find information on older adults and people with disabilities who live in your local community. Effective communication is another important theme throughout the Capacity Building Toolkit. Community-based organizations can partner with local responders to ensure effective communication. And one example is creating what we call a COIN, which is an acronym for a Communication Outreach Information Network, where emergency managers may work with certain individuals or entities to serve as communication outreach resources. So for example, aging and disability networks may be called on to help distribute emergency messages to consumers and caregivers. Also, by establishing effective communication with consumers, community-based organizations can work with consumers to discuss emergency planning, identify the supports that may be needed in the event of an emergency, and discuss the types of services that will likely be provided in the event of an emergency or disaster. The Capacity Building Toolkit provides information on many aspects of emergency planning. So, for example, one module describes evacuation and transportation. We explain the role of transportation in emergencies and the fact that emergency managers can take command of transportation resources in the community. So we recommend including transportation partners in training and exercises to help emergency managers understand that older adults and people with disabilities rely on transportation services to maintain their health and may have medical needs to access transportation services in an emergency. The Capacity Building Toolkit also highlights best practices and useful tools, such as the example here of the 4 elements of evacuation information. Another example of a best practice comes from a tool developed during Hurricane Katrina called Seniors Without Families Triage, or SWIFT tool. So community-based organizations can use or adapt these tools that we've provided and resources to help consumers prepare for emergencies. This one in particular helps thinking about compliance with Americans with Disability Act and addressing functional limitations in the shelter situation. Community-based organizations should be aware of federal laws, executive orders, and national guidance that address requirements to protect the rights of older adults and people with disabilities. Some of these federal requirements and guidance are specific to disasters and public health emergencies, while there are other requirements that offer protection against discriminatory policies, practices, and procedures in general, but these are not waived in emergency situations. So the Capacity Building Toolkit provides a plain language description of these legal requirements that provide rights to older adults and people with disabilities. These federal requirements are applicable to all state and local governments, as well as public and private entities. These federal laws, executive orders, and national guidance provide and enforce equitable access to programs and services. Awareness and understanding of these federal requirements, as well as any applicable state and local laws, can help the aging and disability networks to collaborate with emergency planning partners, as well as educate consumers on self-advocacy. So following a disaster, after the response, typically the longest phase is recovery. Community-based organizations may want to conduct an assessment of their operational and financial impacts to their own organization, assess impacts to their staff members, and find out if they're eligible for any type of disaster assistance. They may also want to develop lessons learned to help with planning for next time. In their role as partners, working with local emergency managers and public health officials, aging and disability networks may want to provide lessons learned to help improve planning for their whole community. They may also want to be included in hot washes or after-action reports and contribute to an improvement plan or updating emergency plans to reflect lessons learned for addressing the access and functional needs of older adults and people with disabilities. Recovery also includes supporting consumers, and aging and disability networks play a critical role here. For example, returning home, seeking disaster assistance, or identifying temporary housing are important and sometimes challenging activities following an emergency. One of the resources we highlighted in the Capacity Building Toolkit was developed by my program. This fact sheet on working with older adults and people with disabilities, tips for treatment and discharge planning, notes the importance of helping consumers who are living independently in the community to be able to find the resources and support to resume living in the most integrated setting following a disaster. Other activities to support consumers with recovery include applying for FEMA individual assistance, as well as providing case management for assessing health and behavioral health needs, and providing referral services. So overall, the Capacity Building Toolkit provides resources that were selected or developed to support community-based organizations in emergency planning. It explains emergency planning in basic terms, including information to help community-based organizations that may be new to this role, and also to advance more advanced resources in helping to improve the capabilities of those that are already engaged in emergency planning. So while we don't expect the aging and disability networks to wear another hat as emergency managers, we do provide enough information to make sure they are informed and able to improve readiness for disaster and public health emergencies. We provide resources to build capabilities for supporting consumers during emergencies and processes for supporting consumers in developing their own preparedness plans. The Capacity Building Toolkit also introduces emergency managers and public health officials to the knowledge and skills of the aging and disability networks and encourages building partnerships. So within each module, we provide resources on important activities, highlight best practices, provide the links, and then provide links to access recommended resources and tools. And then in addition, at the end of each module, we provide a brief description of links to other supplemental resources because that would be useful. And finally, in the appendices, we provide resources that you can use, including templates, worksheets, checklists, definitions of terms, and other information that you can put to use in developing your own community-based organization's plan for working with consumers and in supporting your own emergency planning. So I hope you will check it out, make use of the Capacity Building Toolkit for including the aging and disability networks and emergency planning. It is online, it's free, and it's available through the NACCHO webpage. I think this is a hyperlink. If not, you can just Google the Capacity Building Toolkit. It should pop up there on the NACCHO webpage. It's also available on the ACL's webpage, or you can go to my webpage, which is www.phe/ABC, and you can find it there. And in addition to that, you could also visit our resources on our ASPR webpage. We have lots of other resources and information, including some of the ones I've mentioned and several others. Okay, that's the Capacity Building Toolkit, and thank you, and I'll hand it back to Kandra.
Great, thank you so much, Cheryl. We're so glad that we could create this partnership today, and that these two resources dovetailed so nicely and we could present them to you all. We are going to open it up for about 10 minutes of questions at this point. So if you have a question, please type it in the chat. I know some people have already been typing some questions, so we've been trying to answer those as we go. But feel free to type in the chat at this point if you have any questions. Looks like several people are typing, so we'll kind of wait and as they come through. Okay, so Rob McWilliams is asking, are we free to link these products to our own sites? Absolutely, from the National Center, all of our materials are free and available to the public, and we are very happy for you to link to them. Are there any